So thank you so much everyone for joining in. We would now be starting with the webinar. As you all can see, our expert for today, Dr. Dolly, has already joined us. So namaste, sat sri akal, salamu alaikum, and a very fresh good evening everyone. This is Sanghamitra leading the K management team at Xyla Health, and I'm your host for today. To start with, and for a quick introduction, Xyla Health is India's leading AI-powered health management platform that has served 5 lakh plus people in 595 plus cities and happens to be the highest rated app with a 4.8 plus rating and delivers 24/7 care. We have been helping people with multiple health conditions such as COVID, diabetes, heart issues, kidney health issues, and women's health issues through a very able and experienced team that is in-house at Xyla for the highest quality care. So we all are aware about the common questions related to cervical cancer, be it causes, symptoms, treatment. But is there anything else that we need to be vigilant about? This Cervical Cancer Awareness Month, we are here on this platform to understand more about it. And to answer all these questions, we have with us Dr. Dolly Bagay, who happens to have 3+ decades of experience in this field and specializes in family medicine along with women health. Dr. Dolly has been previously associated with Safdarjung Hospital, Delhi, and has been serving patients from diverse socio-economic backgrounds. Dr. Dolly also specializes in minor surgeries, vaccination, first aid, managing trauma, and geriatric care. So, with this, I welcome Dr. Dolly on the platform today and very excited to understand and learn more from you. Looking forward to this insightful, informative session. So, over to you, Dr. Dolly.
So a very fresh good evening on behalf of Xyla Healthcare and my co-host Sanghamitra. I welcome you all to this important webinar on cervical cancer. So as you can appreciate, Sangha, please focus on the diagram. I want to explain first and foremost what cervix is. In a lady's genital organs, the lowermost part of the uterus is called as cervix. The dark pink part, that is the lowermost hanging part, that is called the cervix. And as you go upwards, the next part is called the uterus, and then both the fallopian tubes that end in the ovary. Both the ovaries, as you can see, beautifully highlighted, dark pink, two structures on either side of the uterine cavity are the two ovaries. Now, why are we talking mostly about cervical cancer and not about uterine and ovarian and tubal cancer? I want to explain why we are talking about cervical cancer, because it is the most easily found cancer in the Indian context and mostly seen in rural India. Now, the reason why we are talking about cervical cancer is that because if it is caught early during its stage, it is treatable, is completely reversible. Very good modalities of treatments are available. And you can virtually treat over cervical. Since it is exposed, this part of the uterus that is known as the cervix is exposed to the seminal fluid during intercourse. So it is very important to understand that when cervix gets infected by the seminal fluid, or there is a viral infection coming from the partner, the human papilloma virus infection, that is the seat of entry of cervical cancer. So that's why we are speaking on cervical cancer, because it's the lowermost part of the uterus. It gets exposed during sexual intercourse, and if your partner is having the human papilloma virus infection, you are bound to get infected with human papilloma virus infection, which is notorious to cause cervical cancer. And as we go along, we will be talking about the human papilloma virus and how we can prevent infection from the human papilloma virus. Now, I want to highlight one thing before I go along the slides is that the the cervical cancer is has the treatment has been revolutionized and the prevention has been revolutionized by the advent of the vaccine. And now I will be taking you to the early symptoms and signs of cervical cancer. And since this part of the body is never seen, so we need to be extra careful with the symptoms. So early stage cervical cancer, it is not producing any symptoms or signs. And that is what we want to become aware of, because the late signs and symptoms of more advanced cervical cancer are not so easy to treat, which are vaginal bleeding after intercourse, between periods, or after menopause. That is for ladies who have attained menopause post 6 months. If there is vaginal bleeding after intercourse, they need to be aware of this bleeding because it's not a normal bleeding. And watery, bloody discharge that may be heavy, most importantly, foul odor. These are the signs of cervix getting infected and may be cancer. Pelvic pain or pain during intercourse, also a symptom, may be a symptom of cervical cancer. Why I am stressing on 2 points is that it is seen mostly in rural area. Women are unaware of sexual hygiene, which leads to infections and repeated infections, and ultimately this lands into cervical cancer. So, what do we need to do? We need to know our risk factors. And what are these risk factors? How can I find out if I am at risk for cervical cancer? By undergoing a few tests. And these tests I will explain are the pap smear. It is the most commonly used cervical cancer screening test. What does it do and how is it done? If you allow me a minute, this pap smear is done most of the times post menstrually. That is, once your menses finish, after 2 to 3 days, we do the pap smear. Now look at the diagram on the right. What is the way to do the pap smear? The doctor is holding a long swab-like structure. So we put an instrument and then we take whatever fluid we can from the mouth of the cervix. If you want to know what the cervix is, go back to the first diagram. The lowermost part of the uterus is called cervix, which we can visualize with our naked eye or also by magnification. So we take the fluid from all around the cervix and from a little bit inside the cervix, and we rotate the brush and we bring it out and we prepare our slides, and these slides are known as pap smear. The other test is the test which I have been mentioning, the human papilloma virus. The HPV test looks for the human papilloma virus and it identifies women at high risk for cervical cancer who may need to be treated to prevent cervical cancer. How do we do the HPV test? By the VIA or these are technical terms. The VIA, that is the visual inspection of the cervix. We look at the mouth of the cervix, how badly eroded or how badly eaten up it is. We inspect the cervix to identify abnormal changes on the cervix, and that can be treated to prevent cervical cancer. So, who's the culprit? The HPV virus. And how do we get the HPV virus? We get the HPV virus by repeated infections or from our partner. So what does it mean? That if I contract the human papilloma virus, will I develop cervical cancer? So these are the human papilloma virus that you can see under magnification. This diagram explains to you, but there is a word of caution that not all HPV can infect both men and women. It is certain strains of HPV. I will not go into those technical details, but few strains, probably 4 to 6 strains of human papilloma virus, which when infect the cervix can take you to cervical cancer. So if you are sexually active, you can get the human papilloma virus. But at the same time, if the strain of the HPV virus is non-carcinogenic, then you don't need to worry. And the good thing about this is about our immunity. Just like COVID, in 9 out of 10 people, the virus clears out itself in 2 years. But in 1 out of 10 cases, it may lead to health issues like cervical cancer. So, why are we talking about this cervical cancer? Why are we conducting this webinar? Is to make you aware about the notoriety of the human papilloma virus and to make you aware that there is a vaccine available against the human papilloma virus infection, which all of us should get, especially our daughters or girls. We target, the government of India is targeting for cancer cervix prevention girls between 9 to 14 years. I will go along and explain why this age of 9 to 14 years or before the girls become sexually active. It is when you have the first intercourse, the hymen is breached and you get infected by the virus.
Extremely sorry, everyone. It seems there's some network issue.
The human papilloma virus or the cervical cancer virus vaccine. So I'll now be explaining how, Sangha, can I have this slide? It is not okay. So let me see how the human papilloma virus is spread through genital contact most often, but not always during sex. It can, now this is for gays. It can also spread through oral sex, and most people do not know that they have got infected with HPV because it's a silent infection. So they don't often realize that they are spreading the virus. And since HPV is common, if you're intimate with anyone, the best way to reduce your chances of getting infected is to be vaccinated by the HPV vaccine before your first sexual exposure. This is the crux of this whole talk. What is cervical cancer and how we understand it and how we prevent it. So another thing, you must have seen that if someone has genital warts, does that mean HPV virus is still present? Yes, if a person has outward signs of infection, such as genital warts, he or she can transmit the virus sexually to the partner. However, it is important to realize that people can also transmit the human papilloma virus even and when they do not have any symptoms. So my stress is to prevent the HPV virus infection or to nip the disease in the bud, and how? By getting yourself the HPV virus vaccine. And additionally, even if someone has genital warts removed, they may still be infected and be able to transfer the virus. So now word of caution is the genital warts and the HPV infection. And now let us see what is available. What are the arms that are available? There are three types of vaccines available now for cervical cancer. It is Cervarix and Gardasil. And the latest kit on the block is the nonavalent cervical cancer vaccine, which is extremely expensive right now. So I'll not be talking about the nonavalent cervical cancer vaccine, but I am highlighting Cervarix and Gardasil. These vaccines contain the virus in small doses, the viral strains that are going to transmit the HPV infection. Those strains of HPV virus are contained in this vaccine in very small doses, so that the body can produce its immunity once they are injected with the vaccine. So that is the crux of the talk today, the awareness about human papilloma virus and the awareness about the cervical cancer vaccine. So now let us understand what is the dose and frequency and duration. As I have explained earlier, it is most important to give the vaccine before the girl or the boy becomes sexually active. In all foreign countries, the Americas, the Europes, both the boys and the girls in the pre-pubertal age group are given the human papilloma virus infection, because it will prevent them from getting infected and transmitting infection. So let us understand what are the doses. If the girl is between 9 to 14 years old, two doses are to be administered at an interval of 6 months. That is, the first dose is given as 0, and then the next dose is given at 6 months from the first dose. But if you miss this window of vaccination, you can still vaccinate 15 years and older. 3 doses are recommended in the schedule of 016 for Cervarix and 026 for Gardasil. In immunocompromised individuals, 3 doses, as mentioned above, are always used, especially in HIV patients. We get to see in HIV children, infected children, we always give 3 doses. So what is the ideal age? As you understand, I have been talking about pre-pubertal, pre-menstrual, before you become sexually active, underlined. It is only then that the vaccine is 100% efficacious. The HPV vaccine is recommended for adolescents, pubertal girls between 9 to 12 years of age, and all teenagers and adults between 13 and 26 years of age who did not get the vaccine when they were younger, but who are not exposed to sexual intercourse. Before the sexual intercourse, the first sexual intercourse, they need to be vaccinated. Individuals between 27 and 45 years of age can also discuss vaccination with their healthcare provider and receive their vaccine if they want to protect from HPV infection. But This vaccine then is given after the pap smear is negative, after the test for the human papilloma virus is negative. Once you are infected with the human papilloma virus, the vaccine is no longer effective. So we need, because the whole idea is to prevent the human papilloma virus infection. But if you are already infected with the human papilloma virus, the vaccine cannot help you. If you already have genital warts, the vaccine cannot help you. So please beware. Take the opportunity of this window, age group of between 9 to 14 years, 9 to 16 years, 9 to whatever age before the girl gets married or she becomes sexually active. In India, it is mostly given to girls, but in all foreign countries, it is given to both the boys and the girls when they enter their teenage. How long after receiving the HPV vaccine does it take for the vaccine to work? So, as you understand, the immune system takes about 1 to 2 weeks to generate the immunity to the vaccine or to the infection. And in case the HPV vaccine, the first dose is taken and the second one, once the person is on a 3-dose series, generates a primary immune response. But protection can vary from one person to another. Therefore, as the age advances, the number of doses goes up from 2 to 3. And the last dose is given at least 6 months after the first dose is important. Just like the COVID, you understand the importance of a booster, so is the Cervarix or the Gardasil booster given at 6 months of age because it enhances the memory of the immune response. And a person will have the greatest protection beginning about 1 to 2 weeks after receiving their last dose of vaccine. So we need to wait for at least 6 months before the immune system is charged with antibodies to the vaccine. That is the reason why we are always recommending the age group of 9 to 14 years or the age group of these children or teenagers before they become sexually active. So now this comes the catch. Can I get vaccinated if I am sexually active? Again, you can get the HPV vaccine. Ideally, it should be given before the person becomes sexually active and exposed to the human papilloma virus. But once you get sexually active, you have not taken the vaccine, then you can go for your pap smear, you can go for your human papilloma virus test. If these are congenial, if they are conducive, then your healthcare provider will advise you the vaccine. But the reason to get the HPV vaccine is that you're not likely to have been exposed to the human papilloma virus that are contained in the vaccine. What I'm trying to tell you is the human papilloma virus is not a single virus. It is a huge number of series of viruses under one umbrella. They are called as the human papilloma virus. Some of the series of this virus can cause cervical cancer. The others in the series are harmless. So it all depends कि आपको कौन से strain से infection हुआ है, which strain of the human papilloma virus you are harboring in your body. That is the most important, and only that will tell us whether the cervical cancer vaccine will be of any help or not. Can I get the vaccine if I am pregnant? No, it's a big no. It is never used during pregnancy. Either you don't get pregnant while you are on the vaccine, you wait for some time, or you take the vaccine after you deliver. So that's the next thing. Sorry, Sangha. So can I have the next slide, please, Sangha? Now I started getting the HPV vaccine and now I am pregnant. The other doses need to be stopped till you deliver. As you understand, I have mentioned earlier that you cannot take the vaccine during pregnancy. So whatever dose you have taken, you need to stop at that. And then if it is more than 6 months, then maybe you will require an extra booster dose. But once the antibodies are tested, you have enough antibodies, then we will follow the whatever is the wherever you have left, we will do the catch-up vaccination. So that is the most important thing I want to convey, that this vaccine cannot be given if you are pregnant. And even though I have got the HPV vaccine, I got genital warts. Will I have them? So these warts are there for good. Even if you have the HPV vaccine, you could still develop the genital warts, which are strain of HPV, which is not contained in the vaccine. Again, I'm repeating the same thing, that the human papilloma virus is a series of viruses. Some are harmless, others are harmful. So it all depends on the strain of the HPV virus which is infecting you. You may want to consider visiting your healthcare provider to confirm the diagnosis of the genital warts. If you do have genital warts, your doctor can go over your treatment options with you depending on your particular situation. So that is what I want to say. Do not get scared. It may be the harmless part of the virus that is giving you the genital warts. And now this is the most important question. How often is screening how often is screening required to improve? If your pap smear and your HPV if your pap smear and your HPV tests are normal, you don't need to get them every year if you're sexually active. But as per recommendations, women between 25 to 64 years of age can get the human papilloma test every 5 years and a pap test with HPV every 5 years, or a pap test alone every 3 years. Every 3 years, sexually active single partner, you don't need to worry once your baseline is healthy. But if you have multiple sexual partners, then this recommendation of getting the human papilloma test every 5 years, a pap test with HPV every 5 years, and a pap test alone every 3 years. You must visit your gynecologist, who can also look at you visually, do the test that is known as the wire test or the visual inspection acetic acid test, and that also tells you where you stand. Sangha, the next slide, please. So, do I need to get screened if I don't have symptoms? People can be infected with HPV for years, even decades. There is a long incubation period. Therefore, before they experience any symptoms of infection, that is why women should get the regular pap test. The two things that I want to stress upon is the regular pap test, the regularity of the repeating of the pap test, the repeating of the HPV DNA test, the visual inspection of the cervix, because we cannot see the cervix ourselves. We need to visit a gynecologist, and the women should get a regular pap screen, because a pap screen shows early signs of changes in the cells of the cervix, the precancerous changes, and treatment is often more successful than after physical symptoms such as bleeding and pain appear. By the time bleeding, pain, discharge, foul-smelling odor appears, it's already gone to probably a locally invasive or an invasive cervical cancer. So thank you for a very patient hearing. I hope I've been able to drive my point across. And again, hello. I hope I've been able to drive my point across about regular pap smears, regular gynecology visits, and the use of cervical cancer vaccine at pubertal age or at teenager age, and most importantly, before a person becomes sexually active. Thank you very much for a patient hearing.
Thank you so much, Dr. Dolly, for making us understand about a few other points, which is not very normal and is not mostly talked about with respect to cervical cancer. Although we already know the prevention tips, the vaccination, but what are the ifs and buts and what are the commonly related questions? Thank you for covering all those. If there are any questions, if there are still any questions from anyone, you can unmute yourself and ask the question now. Any questions from anyone related to today's topic? You can unmute yourself and ask the question directly from our expert today. Okay, so if there are no questions, we will be ending the session now. But if you feel that there's something else that you need to clear, or if there's anything that you need answer for, we would be really happy to help you. Please share your questions over the Zyla application and we'll get it answered by Dr. Dolly for sure. Thank you so much, Dr. Dolly, for coming on the platform today and making us understand about this. Thank you so much, everyone, for joining the webinar today. We'll keep doing such informative webinars for making you understand about these health-related topics.
Thank you and good night, everybody.
Good night, ma'am.